You're tuned in to the deep dive. Today we're exploring a really crucial role within healthcare, the hospital chaplain.
And the way we're doing it is, well, a bit different. We're looking at actual interview questions for the role.
Exactly. Because what an employer asks, what they focus on, tells you so much about what's truly essential for the job itself.
It gets right to the heart of it.
So our mission here is to kind of unpack the core duties, the skills you absolutely need, and just the deeper considerations of being a hospital chaplain.
Yeah, whether you're thinking about this career, maybe you work alongside chaplains already, or perhaps you're just curious about, how support works in hospitals.
We think you'll get some really valuable perspective from this.
It's a great approach because it's grounded in, well, the real-world demands, not just theory. We get a direct line into what it takes.
Okay, let's dive right in then. The source material makes it clear right away. The fundamental purpose is providing emotional and spiritual support.
To patients and their families, often during incredibly tough times.
It emphasizes addressing diverse spiritual needs, offering comfort, guidance, basically being a supportive presence.
Mm-hmm. And that word diverse is so critical, isn't it?
It really is.
It signals straight away that this isn't about one particular faith. It demands, well, a really open, non-judgmental approach to all kinds of beliefs, practices.
Even perhaps a lack of formal belief.
Exactly. It's about meeting people exactly where they are in that moment.
Which leads us straight into the key skills, the competencies these interview questions are trying to gauge.
Right.
The resource points to empathy, resilience, theological knowledge, maybe surprisingly for some, and being able to work as part of that wider healthcare team.
That's quite a mix.
It is a challenging mix.
And each one is vital. Empathy is the foundation, obviously, for connecting. Resilience, well, you need that to handle the constant exposure to difficulty, to loss.
You really do.
Theological knowledge provides a kind of framework, doesn't it, for understanding different views, different spiritual needs, even if you're not applying doctrine directly.
That makes sense. And then the teamwork aspect.
Crucial. Integrating that spiritual care with the medical plan, it has to be seamless.
Okay, let's get specific. Some of these questions really bring it home. One is, can you describe a time you provided spiritual support in a difficult situation?
The classic behavioral question.
Right. And the example answer involved helping a family after a sudden loss.
Mm-hmm.
Things like active listening, helping them navigate grief, honoring the person's memory.
And connecting them to resources, too,
Yes.
importantly.
For me, it crystallizes what empathy looks like in action. It's not just feeling sorry for someone.
No, it's active. It's doing. It's hearing their specific pain, understanding what they need right then, and taking steps, emotional, spiritual, even practical steps like finding bereavement support.
Okay, here's another big one. How do you handle situations where a patient's or family's beliefs differ significantly from your own?
Oh, fundamental.
Absolutely. The core message seems to be respect and an open mind are non-negotiable. The chaplain's job is support, period, regardless of their own beliefs.
It has to be patient-centered, always focusing on their perspective, their values.
That inclusivity feels like it must be just paramount.
It is. Think about a hospital. You encounter everyone, every possible worldview. You have to be able to consciously set aside your own viewpoint and genuinely engage with theirs.
It's about helping them connect with what gives them strength or comfort.
Exactly. Not imposing anything.
The demanding side isn't ignored either.
Yeah.
There's a question about managing stress and avoiding burnout. What strategies do you use?
A very necessary question.
Definitely.
Yeah.
And the answer points to self-care, like a balanced routine exercise, maybe meditation, personal time.
Yeah.
But also leaning on colleagues, networks, supervision.
It really hits on that resilience point again. Burnout is a huge risk in these roles.
You're constantly facing trauma, grief,
Yeah.
intense emotion.
Right. So that proactive self-care, seeking support, it's not just nice to have, it's essential for actually doing the job long term, for your own sustainability.
And collaboration comes up again. Share an experience working with a healthcare team on spiritual needs. The example was about facilitating conversations around a patient's spiritual wishes before a big surgery and supporting the family through that. It shows they aren't isolated figures.
No, not at all. They're a vital link. Spiritual care is part of holistic care, right?
It should be.
Chaplains ensure those needs aren't missed, that they're understood by the medical team. Sometimes it's about translating, spiritual concerns into terms the medical staff get, advocating for the patient's values in the care plan.
There's also questions specifically on ensuring inclusive care for diverse backgrounds.
How do you make sure you're doing it right?
Yeah. And the answer stresses proactively educating yourself on different beliefs, different practices, but also, crucially, active listening and asking respectful questions.
It's about being intentional, sensitive.
And recognizing it's an ongoing process, right? This self-education.
Absolutely. Cultural competence isn't something you just achieve and tick a box. It requires constant learning, constant effort to understand people beyond, stereotypes or assumptions.
Listening and asking thoughtful questions shows you genuinely want to understand their specific needs.
It builds trust.
Which brings us neatly to the final point they cover. Confidentiality. What role does it play, and how do you maintain it?
The bedrock.
Totally. The answer stresses it's fundamental for building trust. You only share what's necessary, keep private talks private, unless you have clear consent.
People share incredibly personal, sensitive things in these moments. They have to feel safe.
That trust allows for real vulnerability, real openness. Without it, the whole relationship breaks down.
Precisely. Confidentiality is non-negotiable.
It's interesting, too. The resource briefly lists related jobs, bereavement coordinator, Bishop Cantor.
Showing the wider context.
Yeah, just a glimpse that these skills, these sensitivities, they pop up in other supportive roles, too, inside and outside formal religion.
Provides that broader perspective. The core human element is transferable.
So, pulling this all together, this deep dive into the interview questions really paints a picture of a deeply multifaceted role.
It really does.
It demands this blend of emotional intelligence.
Yeah.
Spiritual sensitivity, which isn't necessarily religious, right? And very practical skills.
Right. All aimed at providing real, meaningful support right there in the healthcare setting. It requires profound inner strength, deep compassion.
The ability to truly listen.
Yeah, listen with your whole self and navigate these incredibly complex, intimate human moments with grace and understanding.
It definitely gives you a deeper appreciation for the people doing this work, whether you knew much about it before or not.
Hopefully.
Yeah. So, thinking about all this, what are the fundamental human needs that spiritual care in a hospital really gets at? Regardless of anyone's specific beliefs.
That's a great question to ponder. Meaning, connection, comfort in the face of fear, hope.
And maybe what are the unique challenges, but also the profound rewards of being present for people in those intense moments of life, death, and illness. Definitely something to think about. Thanks for taking this deep dive with us.